Our patient was a 17-year-old female, was a college student and avid dancer. She came to us with a history of left knee pain. And how we have reached the diagnosis that she has actually patellofemoral pain syndrome. First and foremost, whenever a patient comes to your clinic or an office, you have to actually get detailed history. Our patient has knee pain, which was intermittent, was off and on dull aching pain for about 6 months. She was able to carry out her activities of daily living for the past 6 months, and there was no problem with dancing as well. But what resulted in the pain was that whenever she danced about 18 hours a week, this resulted in aggravation of the leg pain, which was more common towards anterior and medial aspect of the left knee. So one thing we have come up that usually patellofemoral pain syndrome presents with chronic pain, which is usually of low intensity, aggravated by certain activities like strenuous activities like climbing stairs or dancing, and morely present over the parapatellar region, that is in the anterior, medial, or lateral aspect of the knee joint. Then when we were taking the history, after we had taken the history, we have ruled out certain other things. When we go for the examination of the knee joint, we found out that the only problem she had was actually the tenderness over the patella, especially during the forced extension against resistance. And there was some degree of tenderness over the anterior, the medial aspect of the knee joint as well. Tests related to ACL like Lachman anterior draw were negative. Tests related to the PCL and meniscal injuries like pivot shift test, reverse pivot shift test, the medial lateral meniscal injury was all negative. Therefore, we have ruled out other problems related to the knee joint as well. Then when we were examining, we did examine the hip of the patient, because in our differentials we have to keep in mind that patient can present with actually the hip problem, which the pain may be referring towards the knee joint. Once we have ruled out there was no hip or knee problem, then we went on for the X-rays as well as the CT and MRI as well, because we have to rule out certain patellofemoral maltracking or malalignment syndromes, or problem may be in the knee joint in form of chondromatosis, plica syndrome, or even the arthritis of the knee. We have to rule out when we are examining that problem could be outside the knee as well. For example, this could be related to patellar tendonitis, bursitis, or even the clergyman knee, which may present with these kind of symptoms such as the anterior knee pain. Now, once we have made our differentials, then we have done our imaging, then we go for what exactly our diagnosis. Our diagnosis was patellofemoral pain syndrome. And once we have established the diagnosis, then we can go for the treatment of the patellofemoral pain syndrome. What are the treatment options available? Treatment can be broadly classified in form of conservative and surgical treatment options. Conservative options include analgesics, physiotherapy, which is directed at actually increasing the quadriceps strengthening, and then it's actually avoid those stressful activities which actually leads to aggravated pain. For example, our patient was having pain when she danced a lot during a week, so we can cut down her time so that she danced less and takes rest, so that actually she recovers from our problem. But if the conservative measures fail, then we may have to go for certain surgical procedures. Now, surgical procedures are actually directed at underlying cause, which is creating the problem. For example, if there is instability, we can go for soft tissue procedures such as redirecting the patellar tendon, using semitendinosus gracilis tendon as along to reduce the patellar instability. We can go for certain bony procedures as well. For example, we can go for McPhee anterior osteotomy, anterior displacement tibia tubercle. We can go for anterior medial osteotomy, called as Fulkerson osteotomy, or medialization of the tibial tubercle in form of Elmsile trilite operation. But if the problem is not in the biomechanics of pathology, but actually there is wearing of the underlying surface of the cartilage of the patella, Then we can also go for arthroscopic or arthroscope assisted chondroplasty so that we can regenerate the patellar cartilage and the patient can get rid of this problem. If you want to watch more videos related to the orthopedics or any other subject, whether it's from the basics or from the clinical subjects, go to www.sqadia.com and you can watch all the videos online over there. Thank you very much. Keep watching sqadia.com.